Yes, great. All right. So thank you all for giving up your time to be here and learn something new. I'm always grateful for our community in whatever way that they participate, because that's how we make gains. Along with Auntie Pua, who's here as one of our respite, I think we're part of the original inaugural Prevent Suicide Hawaii Task Force. And it's just always exciting to me as we see it grow and grow and grow exponentially. And the way that it does is people start attending something like this. They want to find out a little bit more and they want to know how they can get involved. So thank you for that. I'm not going to be specifically talking about suicide. It's really definitely on prevention, and I'm going to try and move it even further upstream as we look at resilience. So that will be my focus. So before I'm moving forward, and thanks so much for Agiti's video. That I think that really helps to ground us and talk about why we're here. I mean, I do want to acknowledge those that have lost someone and those that are struggling, as well as those that provide the support in our families and our communities. So pretty much I'm acknowledging every single one of you. You may fit in at least one of those, if not more than those. So thank you for everything that you do. And just some other disclosures. I do have some funding from the federal government for the work that I do, as well as at the University of Hawaii. So I'm going to try and talk about what adversity actually is, and then move into talking about strengths and then the roles that our youth can actually have. So I think when we talk about adversity, the first thing people think of is like, it's always these big things, right? That people are struggling with. And even in my own work early on, when we looked at adversity, we were looking at what we called major life events. And it had to be, you know, something big, something traumatic that was happening. And that's how we perceived adversity. But it's much broader than that, right? There's always these times. Everybody's got ups and downs throughout their life. And it's all those downtimes, those things that are downtimes. But for years and years and years, we have studied risk. That's been our focus when we look at serious types of things that are occurring from a health standpoint, like mental health, like suicide, death or attempts, or even ideation. We start saying, well, what are the risk factors for that? Let's focus in on the risks. Let's try to understand those risks. The more we can understand the risks, the more that we can do about it. And so we have looked at those a lot. And the vast majority of, you know, I'm a researcher, but so I kind of going to be in a little bit of the headspace on this, but the vast majority of what we're looking at, you know, we're like, okay, well, some of this has to do with it's being really hard to talk about it. Some of it has to do with there's maybe no humility and people don't try to understand the story. There's not enough health care or mental health care programs out there. We don't understand how this, you know, regulation works, and we need to look more at that. And, you know, we don't understand trauma. We make things too simple, and lives are so complicated, and you're not having to memorize all this. I'm going to go through like they keep identifying them. Oh, it's economic status, it's financial burden, it's something that happened in the marital status. Maybe it's a breakup, it's a relationship problem. Maybe children are being ignored. Maybe they're not being treated fairly. There's racism. There's, you know, phobias, LGBTQ, cultural diversity. Maybe it's parents are, you know, helicopter parents. Maybe it has to do with how they're raised. They're to this, they're to that. And again, I'm telling you these all really quickly, not because I want you to remember all these different risks, but to know that we have studied risk. And there's a lot of risks out there. And they fit in a lot of different categories. And even locally, we've done that, right? So what have we looked at locally? Well, we looked at, you know, a lot of these different things. There's low socioeconomic status, there's family stressors, there's problems that happen in the family, like maybe somebody's been arrested, or, you know, there's poor family health, right? And we know that many of these things, my work has primarily focused on Native Hawaiian families and youth. And we see that many of these different adversities, right, these things that are happening are put Native Hawaiian youth at greater risk. And we see that Native Hawaiian youth have, in fact, higher rates of mental health disparities. So we see more depression, more anxiety, more suicidal ideation, more suicide attempts. What I want to say, though, is that 85% of those folks that still experience that, 85%, they don't have mental health problems, right? And so why aren't we trying to understand that more? So our research, lots and lots of risks. And I just want to share a couple more things on the risks. And again, tons of different things. We asked the youth themselves, what risks do you see, right? And this is all of the different things that they brought up, that they are in fact dealing with mental health problems. They know about it. They're not always asked about it. They're not always being treated for it, but they know it exists in many, many different ways. That they have a bunch of life stressors, right? A lot of those have to do with the relationships that are going on, and pressures, and especially being compared and judged, and the expectations from families or from society even, that there is aggressions going on, whether it's being bullying or whether how they're being treated at home or being treated in their community, that they don't have all the support that they need. And sometimes, they, as a result of all these things, they get these external pressures and they have internal pressures. They're putting pressures on themselves. This is part of growing up, right? This is part of being a teenager. So, wow, a lot of stuff, right? So again, these aren't these big, a lot of these things aren't these big things, although they did say sometimes really bad things happen to us. They do not say that they're causing these things to happen. They're saying that sometimes bad things happen to us. And so that's how they perceive it. And when we look at it from a suicide prevention standpoint, you can see all these risks, right? In the context of suicide, we see these relationship problems. I think of all these different things as loss, right? So we talked about, we know for suicide, having lost someone to suicide is a risk, and having made a suicide attempt. So again, that's a loss of your own mental health. That's also a risk, right? So loss upon loss upon loss. And we could spend days and days and days just talking about all these different things in terms of the risks and trying to understand the risks. The reason I don't like to do that is there's also some really great studies that have come out of the Native Alaskan and American Indian communities that have said that the time that we spend on trying to reduce risk factors would be better spent in trying to increase those things that help people when they're struggling, those protective factors, those things that may be present in this 85% of the population that doesn't, right, develop a mental health problem as a result of adversity. And they've actually shown that if you increase one of these protective factors, just one, it's like reducing 4 risks. So spend the time on one protective factor, it's like reducing 4 risks. So and that's where we get our resiliency from, right? It's coming from those types of things. So what might those look like? The number one thing that has been found in studies all across the world has been that making a connection with some other person helps to protect you. If there is a person that you can identify with, that you can talk to, and we're going to be doing some stuff about how to have those kinds of conversations, but if you can have one of those people, then that is going to be your best protection. The thing things that I heard in a presentation early on when I started working on in suicide prevention is someone shared that when we do our name tags for work and so forth, that maybe we should share one of these types of things, something personal about us, so that when people see us immediately, they can already start to make that connection. So like if I had like, I love sunrise or, right on my name tag, then somebody else that might like sunrise, or maybe they go, oh, I prefer sunsets, but you're already at a place where you can have a conversation like, oh, I'm a dog person, I'm a cat person, right? So easy ways to start making these connections. Okay. So what are our protective factors? Now, these again are the ones that they share for suicide prevention. And to me, the commonality, every single thing that we're talking about when we talk about protective factors for suicide prevention are all about connection. Connecting to your parents, connecting to a non-parental adult, feeling safe at school, which usually means that you feel a connection there at school and you have close and caring friends. You're safe in your neighborhood. Again, where do we get our neighborhood safety? We're connected to our neighbors. We know who they are. We have access to healthcare. We can connect to healthcare. We can connect to our teachers. So connection is so much about what we're doing when we talk about resilience. And Hawaii, Kauai in particular, is credited with the first big resiliency studies. We had the longitudinal resiliency study. Everybody else was still focused on risk, and they were like, wow, we're going to be looking at this and let's see what we can find out about resilience. What are these protective factors? And they've now been following people for more than 30 years. And the same things are coming up. They came up early and they last. So huge, right? So they found some things about, individual traits that were important, being active and social and have an engaging temperament. But the biggest ones that came up was having a supportive, trustworthy adult, right? Connection with an adult. So for kids, it's super important to be able to connect to an adult. And to have another support system besides your family. And for many, that was a church or through some kind of other youth group, right? So those types of connection, right? So we're wrapping our keiki, right, in support. That is what keeps them resilient. In the work that we did, we were specifically trying to look at connection, what improves our well-being, right? That resilience tied to well-being. And we looked at multiple things, and it's very similar to what the Kauai Resiliency Project found out. We did see a stronger connection with families and family caring and relationship formation. And that relationship formation is a little bit different in our Native Hawaiian youth. It lasts much longer, right? We always think of that adolescence period as pulling away. But for our Hawaiian youth, to suggest that they need to pull away from their family is actually harmful. They need to maintain those connections. And I think, considering myself a local girl, I would say that that's probably true for local youth as well, just because we pull from other cultures here, right? There's a local culture as well as our own culturals. And then, a lot of those things back to the community involvement with spirituality, with friends, and with extracurricular activities. So lots and lots of overlap. And then we found that Hawaiian values became really important and being able to speak the language. So our work was done a few years ago before they actually set up immersion schools. So learning language, again, it just gives that closer tie to the culture, right? That's what we're looking for. And again, the relationship formation, and then participation in Hawaiian activities. So I want to talk about a new project. So that's kind of our history. So we know these things, we know there's things to tap into, and it's not that many things that we need to tap into, right? Build connection. that's the only thing you take away from here, you're done. Bye, see ya. Go out and make connections, right? That's what we need to do. So for the last several years, I've been working out on the leeward side with some great partners at the Waianae Coast Comprehensive Health Center. And we've been trying to look at building resilience and building strengths. And this is our youth group from a couple years ago when we were all in person. But I just want to give shout out to Malia Augustin and Blaine Garcia, because I couldn't do any of the work that I do without their help and support. I mean, I think we make a fantastic team. That's my unbiased opinion. And what we're doing out there is we're using this program called Sources of Strength. And it builds off of these same types of things. It looked at a different way, it put them into this wheel, but it's talking about family support, friends, and mentors. Those are all those people connections that we talked about that really need to be in place. And when we talk family, we're talking about chosen family as well as our biological and given families. And our mentors are those other groups that we talk, those non-related adults that we talked about being so important. And then the other types of things that we need to participate in, the spirituality, whether it be from a cultural or religious, right? It can be very broad, or just connection to nature. And so we're looking at all these different types of things and trying to talk about it and say, what happens? What works for you when you're going through tough times? What do you tap into? How can we build that? And let's work on that. And so a lot of it is about having conversations about this. Like, let's talk about when we're having a hard time. Let's not put that away and fake it. Let's bring it out. Let's talk about those. Let's do it on a regular basis. Let's normalizing having these kinds of conversations. Let's normalize having conversations about how these things make us feel when we're angry about it, when we're sad, when we're worried about things. Let's start talking about those, because if we can talk about those things early, then we can start addressing them, right? We can get engaged, we can tap into these things, and when these things don't work, we can get people to the help that they need. But if we keep waiting and waiting and waiting, and it's invisible and it's hidden, and the kids tell us that all the time, we are so good at lying. We just put the smile on and move forward, and nobody knows what's happening, right? We've got to be engaged in these conversations. And so that's basically where we're moving, right? We're saying life has these ups and downs, and we all go through good times and bad times. So what do you tap into? So I want to ask each of you, and Amanda, if you could pull the poll up, think about these activities and just very quickly go ahead and select some that speak to you. Maybe it's one or two. Usually we have like our go-to type of thing, right, that we like to tap into. But maybe you have one or two more. So I wanted to share with you all, and this is a new slide, first thing being released in our groups. Basically, we work with youth, and then they shared it with other folks. And these are the leading things that came up for our youth and their families and community. And you can see healthy activities was the leading one, and spirituality was second. And then again, mentors was a little hard. The way that we did it wasn't like a poll like we did here. We did it actually where they had to bring up the ideas themselves, and a few of them named people and told them who they were. And sometimes we couldn't tell. So we did our best to categorize them. And you see, they actually tapped into mental health more than they did the medical access as well. But, so what were the findings? So after a year of us kind of looking at where we were at, trying to do this resilience, in the beginning, we had about 27-30%, depending on which adjacent community. We're looking at the whole leeward side there. Reported that they had a plan for suicide. So this isn't just ideation. They're moving a little bit further. But by the end, 1 year later, and being involved in this, it was only 4 to 13%. So a year later, taken at the same time. And the psychologists from the community told us they were coming in earlier, they were more ready to be engaged in this. So, I mean, I'm so happy about these findings. And the community was able to get funds to continue the program because of these findings, even more important. Oh, see, look, I give myself chicken skin just talking about these things. It's so important to me. And you also see, even at the baseline, they were already helping their friends, okay? These kids were not trained to help their friends. They're trying to help their friends. And so now they were getting the tools to be able to do that. The other thing that always gets me in this community is how much they feel that they can make a change in their own community, right? They see that that is their role. That's their kuleana. They're going to make a change. It was already starting, was at 68, 75%. It did go up at the end, but it wasn't this huge thing because they already started so high. So they're already there. And I love that about our youth. This just says that they felt extremely confident in their ability to move it forward. I don't need to show you it all, but you can see it's like over 80% felt confident in their roles in doing this and being involved. That they saw 86% of youth and 100% of adult felt that youth can do this and their voice is powerful and it makes the difference. And we saw that over and over and over again. And that they want us to focus on strengths. The youth felt that this was so important. They're tired of talking about risks. They don't want to go there. And they said if we were talking about risks all the time without talking about strength, they would be gone. They don't want to be involved in that kind of program. And then if you're going to do it, you need to do it in a fun way and an active way and be, and adults and youth side by side have to work on this together. They also wanted us to give more opportunities for the community to participate. So we ended up doing a lot of these activities right after school because that's when the youth were available. We had a few activities for families and community, and they just wanted more. So that was the big request. So we're trying to expand this now. We just actually got a grant to try and do more of this statewide and introduce it at least into a few more communities, but ultimately we would like this to be in every community. So our work is cut out for us.